CCRN Hemodynamics and Shock Practice Test Questions Study Guide, 35 Most Common Questions. Question 1. What is the formula for cardiac output, CO? CO equals HRXSV. CO equals BP/SVR. CO equals SV/EDV. CO equals HR/SV. Cardiac output is the product of heart rate, HR, and stroke volume, SV. Question 2. Which type of shock is characterized by high CO and low SVR? Septic shock, hypovolemic shock, cardiogenic shock, obstructive shock. Septic shock, distributive, often presents with a high cardiac output and low systemic vascular resistance in the early stage. Question 3. A central venous pressure, CVP, of 1 mmHg likely indicates hypovolemia, hypervolemia, right heart failure, cardiac tamponade. Low CVP, normal 2 to 8 mmHg, suggests fluid volume deficit or hypovolemia. Question 4. Which hemodynamic parameter reflects left ventricular end diastolic pressure, LVEDP? PAWP, CVP, MAP, PVR. Pulmonary artery wedge pressure, PAWP, is an indirect measure of LVEDP. Question 5. What is the normal range for systemic vascular resistance, SVR? 800 to 1,200 dynes/SEC/cm-5. 50 to 150 dynes/SEC/cm-5. 2,000 to 3,000 dynes/SEC/cm-5. 400 to 600 dynes/SEC/cm-5. Normal SVR is approximately 800 to 1,200 dynes/SEC/cm-5. Question 6. In cardiogenic shock, which of the following is typically elevated? PAWP, CO, SVO2, heart rate. In cardiogenic shock, the heart fails to pump, leading to high filling pressures like PAWP. Question 7. What does a low SVO2, mixed venous oxygen saturation, usually indicate? Decreased oxygen delivery or increased demand? Increased oxygen delivery, decreased oxygen consumption, sepsis. Low SVO2 indicates that the tissues are extracting more oxygen because delivery is low or demand is high. Question 8. The primary treatment for hypovolemic shock is fluid resuscitation, vasopressors, inotropes, antibiotics. The first priority in hypovolemic shock is replacing the lost volume. Question 9. Which medication is a first-line vasopressor for septic shock? Norepinephrine, dobutamine, atropine, nitroprusside. Norepinephrine, Levoft, is the recommended first-line vasopressor for septic shock. Question 10. What hemodynamic finding is consistent with cardiac tamponade? Equalization of pressures, CVP equals PAD equals PAWP, low CVP, high cardiac output, wide pulse pressure. Cardiac tamponade causes compression of the heart, leading to equalization of diastolic pressures. Question 11. Dobutamine is primarily used for its effect as a positive inotrope, vasoconstrictor, beta blocker, diuretic. Dobutamine increases myocardial contractility, positive inotropy. Question 12. Which value defines mean arterial pressure, MAP? SBP plus 2 dBp/3, SBP plus dBp/2, SBP dBp, dBp plus 1/3 pulse pressure. MAP is calculated as systolic plus 2 * diastolic/3. Question 13. A patient in neurogenic shock will typically present with bradycardia and hypotension, tachycardia and hypotension, hypertension and bradycardia. Hypertension and tachycardia. Neurogenic shock involves loss of sympathetic tone, leading to bradycardia and vasodilation, hypotension. Question 14. The goal map for most critically ill patients is at least 65 mmHg, 50 mmHg, 80 mmHg, 90 mmHg. A map of equals 65 mmHg is generally considered the minimum for adequate organ perfusion. Question 15. What is the effect of nitroprusside on hemodynamics? Decreases preload and afterload. Increases preload and afterload. Increases afterload only. Increases contractility. Nitroprusside is a potent vasodilator that reduces both preload and afterload. Question 16. Which hemodynamic change is seen in late-stage, cold, septic shock? Decreased cardiac output, increased SVR, decreased PAWP, bradycardia. In late septic shock, the heart may fail, leading to decreased CO. Question 17. Which pressure is measured at the end of expiration? PAWP, CVP, both PAWP and CVP. Hemodynamic pressures should be measured at the end of expiration to minimize respiratory interference. Question 18. An intra-aortic balloon pump, IABP, is timed to inflate during diastole, systole, early systole, mid-systole. The IABP inflates during diastole to improve coronary perfusion. Question 19. What is the most common cause of cardiogenic shock? Acute myocardial infarction, pulmonary embolism, sepsis, hemorrhage. Large MIs are the leading cause of cardiogenic shock. Question 20. A patient with a high SVR and low CO might benefit from vasodilators, vasopressors, fluid bolus, beta blockers. Vasodilators help reduce afterload, SVR, making it easier for the heart to pump.